task force, which issued this report about a month and a half ago. It's available online at opiateaction.org, the report I have in my hand, but I wanted to go through some statistics just to give you an idea of what we're talking about. Opiates. Well, people wonder sometimes, what are opiates? They hear about heroin. But opiates can also be prescription drugs like hydrocodone, oxycodone, Vicodin, Loratab. And they were originally prescribed by doctors as being a safe alternative for pain management, non-addictive. We now know that is not the case. They are exceptionally addictive. They actually rewire a person's brain so that if they do not have the drug after approximately 2 weeks of taking it, they are addicted to it. And often individuals become addicted to it because of drugs that were legally prescribed by their doctor. And their doctor may have given them a dose for 90 days worth of hydrocodone to take care of a tooth that was pulled. And what happens when you take a drug that you receive from your doctor? You take it for the time that was prescribed by your doctor. And unfortunately, what we're creating is a nation of individuals who are addicted. It is an epidemic stage in the country. It is a pandemic stage in some states, like West Virginia and Kentucky. In a 3-year span in the state of West Virginia, they prescribed so many opiate pills, it was the equivalent of 433 pills per individual in the whole state for 3 years. One pharmacy in West Virginia that represents a town of about 350 people, it's the main pharmacy for a county of about 8,000, prescribed more than 9 million pills in a 2-year period. It is a pandemic in West Virginia, in Kentucky, and parts of Pennsylvania, and it is a problem in serious parts of New York State. These are statistics that were issued just recently by the CDC and New York State Department of Health regarding drug deaths in 2015. And as you note, there were drug overdose deaths accounted for 52,404 deaths in the United States. 33,000 of them were opiate-based. So the vast majority of those are related to opiates, prescribed drugs as well as heroin. Synthetic opiates other than methadone, and this includes fentanyl, death rate rose by 72%, and fentanyl is the main killer right now. It takes no more than 5 or 6 grains of fentanyl to kill. And unfortunately, there are individuals who are taking drugs that they think are heroin or something else, and it's pure fentanyl, and it's an instant death sentence. Heroin death rates rose by 21%. Death rates involving heroin, synthetic opioids starting to go through the roof. And in New York State, between 2014 and 2015, it was a 136% increase in deaths in New York State in a 1-year period. And we know that number is probably doubled from 2015 to 16. This is an important slide to look at because it also tells who this drug epidemic is killing. Killing individuals between the age range of 25 and 34 predominantly, and those are the ones where the numbers are skyrocketing. All age ranges are seeing increases, and it's, as we'll see from some numbers from Erie County and across New York State, it's across the same specter across New York State. Urban, suburban, and rural, the numbers are almost all identical no matter where you're going. 25 to 34 is the predominant range of death, but it's everywhere. In Erie County, we had a 16-year-old die last year, and we had an 83-year-old die as a result of an overdose. And we see those numbers pretty much everywhere. I want you to look at this map because all of your counties are on this map. And you'll see darker areas where the numbers are higher, and you'll see lighter areas where the numbers look better. The darker areas predominantly have medical examiners. The medical examiners are not as afraid to identify and write on death certificates what actually caused the death. Coroners, and there's nothing against coroners personally, but often they run for office. They know the individuals that die. This is just not in New York State. On the National Task Force, we identified in areas where you do not have independent medical examiners, they're usually underestimating the number of deaths. So if you live in one of those counties that's white or lighter, and you're thinking, wow, we're great, your numbers are probably a lot higher. They're just not being reported as deaths by the local coroners, or for that matter, they're not even getting to the coroner in the first place. In individual overdoses, a family does not want to report it because they're so mortified that their child died as a result of a drug overdose. they call the funeral director. The funeral director then writes on the death certificate, unknown, heart failure. You see a perfectly young individual dying of heart failure. It is often a result of an overdose that the family or a coroner does not want to admit to. Now, I'm not saying all coroners are doing this, but we've seen this all across not just New York State, but in across the country. And what the problem is, it's probably underestimating the actual number of deaths. So it's probably lessening the impact in the eyes of elected leaders because they see numbers and they say, oh, our deaths aren't that bad, when in fact they probably are. They're just not admitting to it. These are our Erie County numbers in the last few years. 2012 and before, it was roughly the same. We averaged about 100 deaths annually out of a population of 923,000 as a result of heroin predominantly. Some prescription drugs. Then we saw the increase starting in 2014, a jump up to 127, then the skyrocketing of doubling to 256 in 2015. And as of 2 days ago, or excuse me, the end of last week, we had 247 confirmed deaths in 2016 in Erie County, with another 77 pending. It's a lot of deaths. It's about 330 deaths. At the beginning of last year, at the rate of deaths that we were having per week, we were anticipating by the end of 2016, if we didn't change it, we were actually going to have more than 500 deaths in Erie County because of opiate-related overdoses. And to tell you the truth, compared to other parts of the country, our rate of deaths are actually much lower than other parts of the country. It is truly a pandemic in some parts of the country. It is an epidemic in Erie County and in other parts of New York State. And I think it's very important for people to understand, you might not have, because of the size of your population, 330 people dying in your county, and I certainly hope you don't. You might have 50 or 40. But based on the size of your population, you actually may have a greater percentage of individuals dying per capita. And it's very important that every county know their numbers. Because one of the things that we found out is not everybody does know exactly how many individuals have died in their community, made the correlation to the number of deaths compared to other deaths in their community. For the first time ever annually, there are more people who have died as a result of drug overdoses last year than those that died as a result of automobile accidents. And if you had said that 5 years ago, all of us would be shaking our heads saying, you're kidding, that's never going to happen. But it has happened, and we think it's very important for people to understand these numbers and statistics in your own hometowns. People say, oh, it's a city issue. Heroin junkies, it's a city problem. It's not. There are more people that had died in Erie County as of the confirmed deaths that we had in 2016 that live combined in the suburbs and the rural areas than live in the city of Buffalo. The city of Buffalo is about 270,000 people. It makes up roughly 28% of our population. 43% of the population of those who died were actually residents of the city of Buffalo. But if you make the comparison, in the suburban towns, it's almost identical, the amount of deaths in the suburban towns compared to those in the city of Buffalo. When you add the rural numbers in, it's higher. And what we're seeing is rural communities across the nation are being decimated because they've never had problems like this before. They've never known how to necessarily address them. And it's very important that you know the statistics in your own community, because what you'll find out is you can tailor your response based on where the deaths are actually occurring and how to deal with it, whether you need to deal with volunteer fire departments, whether you need to deal with town supervisors, and I know we have some town supervisors in the room who don't necessarily want to address this issue because it's not a fun issue to talk about. I never planned to be the county executive who would be dealing with this issue. You don't run on, hey, I'm the county executive who's going to bring more methadone clinics to my county. That, I can tell you, is not generally a vote winner until everybody in the county sees these numbers and then they realize someone that they know in their family or someone else is dealing with it. I attend a lot of wakes, too many wakes. Last week, I attended the wake of a 43-year-old woman who's the daughter of a retired state Supreme Court justice on the 4th Division of the Appellate Division in New York. They actually talked to the Buffalo News about their story because they want the public to understand if it could happen to them. Very well-respected state Supreme Court justice. It could happen to anyone. And it did with their 43-year-old daughter who just came out of recovery. One day back, she died of an overdose. It's very, very sad, but it shows that it can happen to anyone, anywhere. And if you think it can't happen to my family, it can. If you think it's not going to happen to somebody in my town, it will, because it does, even if it's not necessarily being reported. Gender, you'll see these numbers very similar in your own communities in Erie County. It's generally a male issue, although we are seeing the deaths as a result of those that are female, but it generally has been a male issue. It just seems to be a drug that is more widely used by males than females. And then deaths by race, it is primarily a white issue. There are individuals of color who are dying as a result of the opiate epidemic, but when you make the comparisons, and this is Erie County, which if you looked at the percentages, we roughly have a population of African Americans of about 12%, and that is not what you see on the number there. So we are seeing an inordinate amount of deaths that are white. I know this is really a happy thing to be talking about at lunch. I'm sorry, but it's very important to talk about because the numbers continue to grow. We've been dealing with in our county, and we're sort of stabilizing the numbers, but what we're seeing from other counties in New York State, Pennsylvania, elsewhere, is the numbers are continuing to grow, and you have to address this head on. Age, the average age of individuals who die of overdoses is between 20 and 40. It's our next generations. It's sons and daughters, it's fathers and mothers, sisters and brothers. People in their prime are the ones that are being taken. Deaths, this is an important one because I think it kind of tells how the drug dealers have changed the way that they're addressing this issue. For many years, if you looked at opiate-based overdoses, it was almost all heroin. Then you saw prescription drug numbers jump in. And you see that in 2015, those would be the other opioids. But you see a big spike starting in 2016, and what we've seen already in 2017 is the same thing, is it's fentanyl-based drugs. They're opiates, but they're a higher, more potent drug. Dealers are putting it in the drugs because it does give a higher, more potent type of high, but it also can kill you much quicker. As I said, depending on the fentanyl, if it's pure fentanyl, 5 or 6 grains of it in a little packet of heroin is enough to kill somebody. And there are individuals who are using pure heroin or pure fentanyl and don't even know it. It's an instant death sentence. And the drugs are changing. The heroin's basically being produced in Mexico. They're adding fentanyl-based chemical analgesics and others that are being made in Chinese labs that are being cut, and there is no such thing as quality control when they're mixing heroin and fentanyl by the drug dealers. And then it gets out on the street and you don't know what it is. There was a big spike in overdose deaths in southern Ohio and in northern Kentucky about 2 months ago, and it was a result of drug dealers adding an elephant tranquilizer to the drug. They don't care. They have a business model. It's a failed business model. We're going after them, but they don't care. They just add it to the drug. So what did we do in Erie County? And this is very similar to what other counties have done across New York State, and I commend everybody who's done it because you need to take the lead on it. But when the numbers started skyrocketing, my health commissioner, my mental health commissioner came to me and said, Mark, we got to do something. We can't hide this. We got to admit it. We got to take the lead on this. So I, like many other leaders in this room, decided to create a task force, but I actually declared a public health crisis in our community. First time that a public health crisis had ever been declared for what would be considered a man-made health crisis, not something related to hepatitis, anything like that, Ebola. And we declared and created a task force, which also includes representatives from other counties across Western New York, because we realized the drug dealers don't care about the dotted lines on the map. They'll ship their goods across county lines. They'll ship it to wherever the individuals are that are using it, their clients, so to speak. And we created this task force and realized it can't be just one set. It has to be everything. I've looked at this as exactly what FDR did when he came into the Great Depression. He didn't just throw 1 or 2 things at the wall to try to address the Great Depression. He came up with so many different programs, threw them at the wall, and saw what stuck. Not everything's going to work. And what we did is we tried so many different programs to see what works, knowing that some things will, others won't. And we created this task force, of which there are 7 subcommittees, ranging from we call it REAP in Erie County, Rapid Evaluation Appropriate Placement, very similar to the Gloucester method and what other are doing across New York State. a support group that's led by families of individuals who lost ones as a result of the opiate crisis, to help counsel and mentor those that are either dealing with it as a result of a child or a family member who's still alive and how to get through it, or those who unfortunately have lost their life. A community education in which we're educating everyone. Schools, medical schools. We have a medical school through the University of Buffalo. Others, to say that this is not something you can ignore because it's probably happening one way or another. If you're an older adult and you have pills in your cabinet that you're not using that were prescribed, get them out of your cabinet. You've got to get them out of your cabinet because one of your grandchildren may be stealing them. That's often how children get addicted to these in teenage years, in their 20s. They steal from their grandparents that have prescriptions that go and use because they know that it can be a high. And they get addicted to the prescription-based opiates that way. So we're educating folks. We're coming up with provider education and policy reform. We actually wrote new guidelines for doctors in Erie County, which I'll get into in a moment, through this through this subcommittee. And it's actually had a difference, made a difference. We're working with our hospitals. For the first time ever, we have 3 main hospital organizations in Erie County in Western New York. We actually got them all in a room together to come up with the same type of treatment protocols for individuals who come in either in the emergency room or after major surgery. And it was unheard of because they were dealing with it. Individuals were coming in with overdoses, and we needed to know how to treat them and how to provide them. And also, if somebody comes in with an injury as a result through the emergency room, what type of doses they should be prescribed by the emergency room doctors so that they were not getting dose levels of prescription opiates that would then addict them in the future. Naloxone, everyone, a lot of those are known as Narcan. If you have not trained your first responders on Narcan, you must train your first responders on Narcan. You should also train the public on Narcan usage. We've trained over 15,000 people in Erie County, 10,000 of them alone, just general public, on the use of Narcan, because Narcan can save. It's a tourniquet. It will save an individual from basically dying, bleeding out. It will not prevent them from potentially overdosing in the future. So if you do have a program where you provide naloxone and you go through a hospital, it's very important that the hospital knows what to do with that individual after they've had their overdose. They get them in a proper treatment facility for that individual. And also treatment providers, and we'll go a little bit into that in just a second. Don't have that much longer. But it's very important that you bring your entire community together. This is not a law enforcement issue solely. We cannot arrest ourselves out of this problem. It's not a healthcare issue solely. You cannot just deal with it in treatment. You have to bring everyone together at the table to do this, and then you actually will have a legitimate availability of actually making a difference in your community. Because, as I've said to law enforcement personnel, they have a role. But their role is just one of many roles that we need to play a role in going forward. These are the guidelines that we put together working with the Erie County Medical Society. Why did we work with our medical society? Doctors don't want to be told how to prescribe drugs by government. Just simple as that. My health commissioner, we generally present a presentation. This is the abridged version between myself and my health commissioner. When we first started going and talking to doctors about proper prescription levels for opiates, they were like, great, that's wonderful. Nah, we're not going to do it. So then we went to the medical society, because that's who the doctors listen to. Their local society, their organization, very similar to NISAC, that provides recommendations to them. So we went to the Medical Society of Erie County, and we said, here's the proper guidelines. We want you to work with us, and we'll come up with these guidelines together. They agreed. They issued it. We started to see doctors actually change their prescription methods. Why do I know that? The #1 drug in Erie County under the Medicaid program, and we know this because we have a Medicaid Inspector General's office, for 6 years in a row was hydrocodone oxycontin. I don't know, because I have not actually seen the private insurers' numbers, because they don't reveal that. But I've given them the data and said, these are the #1 top 10 prescribed drugs in Erie County. How does that look compared to yours? And they're like, well, we can't tell you exactly. I said, how does that look? And their response is, this doesn't surprise us. I bet if you actually were able to dig down through your data from your Medicaid, you would find out that the #1 prescribed drug in all of your counties for the last probably 10 years was hydrocodone oxycontin. In 2000, 2015, we know that it was 9,450,000 pills were prescribed in Erie County for opiate-based drugs under the Medicaid program. In 2016, we've been able to drop that to about 8 million. It went from the #1 prescribed drug to the #3 prescribed drug. Now, that's great. We've seen a reduction, and it's very important because that means doctors are paying attention and realizing they've been part of the problem too. But if you go through in all of your counties and you take a look at your Medicaid data, and that data is available through the New York State Department of Health, even if you don't have a Medicaid Inspector General's office like we do, you will find out very quickly that this is when people talk about gateway drugs, the #1 gateway drug for this drug epidemic is not marijuana, it's not cocaine, it's drugs that were legally prescribed by physicians. And it's very important that you know that because it addresses how you deal with the epidemic. You can't, as you say, cannot arrest your way out of it. You've got to deal with individuals who were legally prescribed in the first place. Now, there's something that we've found out on our national task force that is probably the #1 way to deal and help with a person who's addicted get off their addiction in the long run. It's something that elected officials don't necessarily want to talk about, and it's medication-assisted treatment, including methadone. Counseling an individual, having them go to counseling sessions, has, according to my health commissioner and our mental health commissioner, if you don't do anything else with it, it has a 0% chance of getting the person clean. You cannot go to like Alcoholics Anonymous and sit there and have a 12-step program to get off opiates once you're addicted. Your brain has been rewired. You have to address it in many different ways, and the best way is a medicated assisted treatment. And I'm not going to ask for a show of hands, but I'm fairly confident if you ask elected officials, how many of you are willing to go out publicly and say, we need more methadone clinics? I've done it. I'm not asking for a show of hands. If you're really going to lead in your community, you have to do it. I know some large counties in this room that do not have a methadone clinic in their county. And people that drive hundreds of miles to Erie County or New York City or some of the other counties to have access to it. Why? It works. It actually works. There's methadone, which is in some ways, depending on the level of addiction, is the only way an individual can really be treated through medication. There's buprenorphine. It's a pill. You can take it in your doctor. You can have it prescribed by a doctor. It's a much better way than going to a methadone treatment facility. But the problem with buprenorphine is there are not that many doctors that prescribe it. And even the ones that are legally able to prescribe it, and they have to go through a special training course to do that, they don't like prescribing it because there's wraparound services associated with buprenorphine that they have to provide. So you have to work with treatment providers to work with those doctors to prescribe buprenorphine. Naltrexone, Vivitrol, I know there were discussion in the Public Safety Committee with regards to what's being done in jails, and they're doing some really good pilot programs in jails across New York State with giving Vivitrol, which is basically a shot that can last a month. The problem is not what happens with the individual in the jail. The problem is what happens once they're let out of jail. Because after the Vivitrol wears out, if they don't have access to the Vivitrol through a doctor, which they may not have received the doctor's information to go after they're out of the jail, guess what they're going back to? They're going back to heroin. Why do people go to heroin? Why do they migrate from heroin from prescription drugs? Cheaper. The average cost for one pill on the street of an opiate drug is about 50 to 60 bucks a pill. The average amount of heroin to equal the high from the pill on the street, depending where you are in New York State right now, is $10 or $15. So people you would never thought migrate to heroin because of the cost associated. Because once their supply shut off, they need the drug. So if you can get them into a treatment, whether it's methadone, buprenorphine, Vivitrol, that will offset their need for the drug. But there's not as many prescribers for that. And methadone is not something that people necessarily want in their community. We have 3 methadone clinics in Erie County. We just approved, working with Oasis, a 4th, which is going to be in the town of Amherst. If you know what the town of Amherst is, that's where the University of Buffalo is. It's also our largest town, and it's probably our most affluent town. 10 years ago, if we had reached out to the supervisor in the town of Amherst and said we want to open a methadone clinic, it would have been a NIMBY. Oh, no, not in my backyard. Not the case anymore. They've actually been very welcoming. It's been approved by the planning board of the town of Amherst. Citizens who understand that this needs to happen because, as you saw that slide earlier with the number of individuals who were dying, it's not just the city of Buffalo, it's residents in these affluent communities that are dying. And so it's very important that you reach out to communities and say, I know you may not be happy with this, but you do need to address it. And the best way to do it is through a medicated assisted treatment. You may not have doctors that do buprenorphine. If you don't, your Department of Health should try to work with local doctors to do that. And if you have a jail Vivitrol program, you also need to ensure that there are doctors available to treat those individuals once they leave jail. Because if they're not, they're going to migrate back to heroin. It's as simple as that. These are just some of the recommendations. A number of the things, what we talked about is primarily done in Erie County, but all those things we've done in Erie County are recommended in the National Task Force. I'm glad to say that when we looked, as the only representative from New York State, New York State is ahead of the curve with regards to treatment and how we respond to the crisis. There are communities across New York, the country, that are well behind the curve, and that's one of the reasons why you have pandemics in certain parts of the country. But if you ignore the problem, especially as a leader, it's not going to go away. The state can pass laws, and the laws that were passed last year were good laws. There's additional funding in the governor's budget to address this. It's good. But the only individuals who can really solve it in the community are the community leaders. I never thought I'd be talking about this issue and learning as much about it as I did, but when you find out and are worried and thinking that 500 people are going to die in your county on an annual basis because of drug addiction, you've got to act. The numbers in your counties, in all likelihood, are a little lower than what actually you think they are. I mean, a little lower than what's reported is lower than what actually occurs. We know that is the truth, so you need to dig down and actually get true data. The data is important. This is one thing where data analytics makes a big difference. So I think it's very important that people know about this subject matter because it is all over the place. I do thank, as I said, County Executive Molinaro for allowing me the opportunity to work with his staff and do a presentation in Dutchess for the Hudson Valley, as well as County Executive Balone on Long Island. We will be in the southern tier in a combo of Broome, Tioga on February 8th, and then Onondaga. We are willing to go to other parts of the state to give this presentation. It's a much longer presentation. And then, of course, we have a question and answer period. So if you're interested in having this presentation, you're part of the state, please see me. We'll come with my health commissioner, our special assistant, and kind of go through the details. None of us want to deal with this, but we have to deal with it. And all I ask you to do, our leaders, is lead. No one else will if you don't do it. And if you do it, trust me, it sends a message to the greater community that it needs to be addressed. And the business community will then stand up and say, yes, this needs to be addressed. So don't be afraid about the business community saying, don't do it. They didn't do it in Erie County, and if anything, the response was, thank you for taking the lead to address an issue that we know exists. If you do it, you will be addressing what really is the public health crisis of our time, and you will be remembered by those families for making a difference. Thanks, everyone.